Liverpool has become the first city in the UK to trial the use of mass testing. Now, the Northern English town and city of Liverpool has one of the highest infection rates in the country, and last month became the first place in the country to enter the most severe of the three-tier regional lockdowns. The pilot scheme offers 500,000 people a new rapid test, even if they don't have symptoms, to help stop the spread of the virus. 2,000 members of the military have joined NHS staff to carry out the work. And to discuss this now, let's speak to Paul Brandt, a Cabinet Member for Public Health at Liverpool City Council. Thank you very much for bearing with us while we just went to that press conference earlier on. Can you just explain to me how the rollout has been so far and how quick can you get a result from these rapid tests?
These are new rapid tests which will enable the person to get a result within 15 to 30 minutes, so incredibly quickly, much quicker than the standard test, which can take days for the results to come through. And that means people can modify their behaviour very quickly to take account of their updated status.
And how has the rollout been? Have you had many people turning up today? What is your goal? Are you hoping to actually reach every single person in the city?
It's been astonishingly successful. We've seen queues of people outside our 6 testing centres, and we're hoping to roll out 10 more testing centres in the next few days. The reception from the people of Liverpool has been astonishingly positive, and we're hoping that we can therefore get the testing throughout the bulk of the population multiple times over the next couple of weeks, which will enable us then to identify who's got the virus so they can self-isolate, and we can break that chain of causation that's resulted in the viral infections levels reaching such a high level here in the city in the past.
But, you know, there is always a subsection of society who does not believe in the dangers of the coronavirus. They do not believe in testing. So you're not going to be able to test every single person in the city.
That's absolutely true. We don't need to reach absolutely everybody. I'd say to those people who have scepticism, look at our hospital wards. We have more people in hospital in Liverpool with COVID than we did at the peak of the first wave. And it's worthwhile looking back from the lessons of history. More people died in the second wave of the 1918 flu pandemic than died in the first wave. We are really stressing the importance of making sure that now, before we enter the real winter pressures, when flu and other respiratory illnesses will increase pressure on our hospital services anyway, that we bear down on the virus. And that means the usual measures of hands, space, and making sure that you socially distance, but also taking advantage of this new novel opportunity to get tested, even if you don't have any symptoms, so that those people who don't yet know that they are infected can become aware and can self-isolate and take themselves out of the transmission route.
Paul Brandt joining us here from Liverpool City Council. Thank you very much indeed.